I think we are about ready to get started. And based on what we're seeing, the majority of folks do have audio, so we're feeling pretty good about that. So good afternoon, everyone, and welcome to our webinar. We're really glad that you decided to join us for this follow-up to our October webinar and meeting. I'm Mary Hooper. I'm the Executive Director here at the Ida Eye Center for Integrative Health. And as with our last webinar, alongside me today is Ann Rodriguez, our Assistant Director.
Good afternoon.
And she's managing the technical pieces, and I so appreciate that.
And that is just a qualifier right there of how it might go.
But it's working. And as with our previous webinar, I want to thank NC Families United for bringing everyone together for this learning opportunity. I particularly want to thank Gail Cormier, Stacy Justice, who hopefully is joining us as she planned to from pretty far away today, Joanne Scatura, as well as today's facilitators, who I understand are Marianne Haskell, Chandrika Brown, Tika Dempson and Jennifer, Diane Crisanda, and Sonia Hopkins. I also want to thank our webinar sponsors, Healthy Blue NC and Carolina Complete Health. Joining us today representing Healthy Blue North Carolina, we have Rita Hanson-Bowl, Director of Network Relations, and Brittany Smith, Community Outreach Manager. Joining us, we hope a little bit later, will be from Carolina Complete Health. We're hoping that Pam Perry, Vice President, will also be joining us. And a little later, these folks will be providing some information about their organizations. A couple of very brief housekeeping items before we get into the nuts and bolts of this webinar. Stacy, at some later point, will be providing you with instructions to access copies of this slide, a recording of the webinar, and a copy of all of the questions and answers that we'll be discussing today, but that'll be after the webinar. Also, as you meet in your groups, you may have some new questions. We encourage you to keep lists of those additional questions. During this webinar, we'll be providing ways for you to get those questions answered going forward. So now, before we get to today's agenda, I'd like to do a quick review of the areas we discussed during our October webinar. We discussed the 6 standard plan regions. We talked about the implementation timeline for the standard plan, and we'll talk a little bit more about that in a minute. We discussed the 5 PHPs, that they're all required to provide the same essential Medicaid services and that they can offer additional non-medical services. We described the enrollment broker, ways to reach enrollment broker specialists and what they offer, and we identified additional resources. After that webinar, your groups continued to discuss and formulated questions. Your group facilitators sent those questions to Stacy, who passed them on to Ann and me. And for the past several weeks, we've done our best to find answers to your questions. We've gone to subject matter experts in the public and private arenas, starting, of course, with our own DMA experts. So now let's move on to our plan for today.
So today we are going to give you a quick update on the Medicaid Managed Care Go Live date, what we know about it. We're going to answer some of the questions that we collected from the first webinar. We're going to identify how local collaboratives and community groups can continue to ask questions, provide feedback, and get answers beyond these webinars that we've had. And we're going to gain some insights from Healthy Blue and Carolina Complete Health on how families and community stakeholders can work with them. After today, you will have the following resources available to you. So you'll have the recording of webinar number 1 and the handout of the slides. You're going to have a document with the list of questions that you gave us, all of them, after the first webinar, the questions that you put together, and the responses that we were able to provide. And then you're also going to have a recording of the webinar number 2, which is the one today, and the handout of the slides that we're working through right now. So let's talk a little bit about where we are on Medicaid transformation. And I'm sure that a lot of you have heard that we are in a budget impasse between the governor and the NC General Assembly right now, and that continues. The funding that is in the budget for Medicaid transformation must be available in order for Medicaid managed care to be implemented. So NCDHHS Secretary Cohen has stated that she will make a decision on the go-live date for Medicaid managed care in November, and that's coming up. We are in November, so that decision's coming up. This does not impact open enrollment for the standard plan as of right now. So the deadline for the self-selection of a prepaid health plan continues to be December 13th. So just another minute-by-minute update on whether we will go live on February 1st. We have heard that the HHS leaders will be meeting tomorrow to decide if and when the go-live date will be changed. So we are expecting an announcement to be out about whether we'll stick with February 1st or if that date will be postponed sometime before Thanksgiving.
So as we hear things, we'll let you know. But here's where we know where we stand today. So in terms of your questions, as I said, our plan is to structure the content of today's webinar around your questions. That has not changed. And we will say, to your credit, you raised a whole lot of questions. So we took your questions and we grouped them into what we thought were sort of the natural sections that we could put them into, and we started from there. Given the amount of time we have today, we're not going to go through each and every question. Rather, we'll address each of the sections that you see on this slide. We've considered all of the questions in each section and pretty much attempted to hit the highlights. In some areas, there were a few questions that were very, very detailed. If you happen to ask that type of detailed question and you don't hear us answer that today, do read through the individual Q&A document that we'll make available after this meeting. One additional point we need to make here. I will tell you that actually there are some, not a lot, but some questions for which there currently are no answers. That's mainly because those are the areas that are still under development by DMA and the state. Foster care is an area that's an example of that. So in the Q&A document that you receive after this meeting, where there is no answer, we've simply noted the question and we've said there's no answer for that question at this point. So during today's webinar, we plan to focus on the 5 areas that you had the most questions about and that we were the most successful in providing responses for. And those are Medicaid beneficiary enrollment, eligibility, services within the standard plan and LME MCOs, services outside the standard plan and LME MCOs, and transitions of care. So let's start with beneficiary enrollment, since this is or was the first step for all Medicaid beneficiaries in becoming part of a standard plan. And we've said this before and we're continuing to say it. You still have until December 13th to choose a plan. So let's think about this. Today is November 19th. If you received a letter in the mail telling you that you or a family member that you're responsible for is being assigned to a standard plan, then you have until December 13th to choose that plan. So effectively, you now have 24 days to make that choice. After December 13th, you or that family member will be auto-enrolled. And as the slide says, you still have 90 days after the go-live date, which as of today is still February 1st, 2020, to change your PHP without question. Now, we received a number of questions about how auto-assignment will be made if an individual does not choose a plan. The decisions about auto-assignment are made by the state, meaning DMA, not by the enrollment broker. The state has developed an algorithm that takes into account a number of items that include things like geography, current providers, and a number of other things. More details on that algorithm are in the Q&A document. So just remember, December 13th, 24 days from now. Now, there are multiple ways to contact the enrollment broker. You can call You can be in touch via the web or regular mail, and there is an app for that, just like many other things. And when you contact the enrollment broker, you don't have to make an immediate decision. You can gather information, you can take information back, and you can discuss with your family, with your partner, with your friends. And then if you want, you can call back and make your decision that way if you want. You just need to remember that you must do this by December 13th if you want to make that decision and not go through auto enrollment. And that information is on the slide. The enrollment broker can offer a lot of information, but as this slide points out, the enrollment broker does not have details about people's specific treatment history or clinical needs. The enrollment broker does not have access to the claims files that would show what services you receive. This means they cannot talk to you specifically about services you are receiving currently. And the enrollment broker cannot tell people what's best for them or offer opinions about the right services or PHP for an individual. We talk about the enrollment broker providing choice counseling. If you see in the documents that we provide to you the word counseling, understand that this counseling is about choice counseling, meaning providing you with information so that you make choices. The enrollment broker does not tell you what is right for you, but provides you with information so that you can make that choice. Medicaid plans are designated by individual needs, not by family needs. So we wanted to note that plans are specific to individuals. This means that each family member who is a Medicaid beneficiary who qualifies for Medicaid can actually choose a separate plan. There can be households where individuals are on multiple plans.
So you also had questions about eligibility, and it's really important to know that the eligibility requirements for Medicaid have not changed, and they will not change because of managed care. NCDHHS is making a big change in how they manage Medicaid so that they can stay within their budget, but they are not changing who can get Medicaid. So if you look at the slide, you see that the information that DHHS and your local DSS is going to use to determine if you are eligible for Medicaid has not changed. And that includes that what they use to determine if you're eligible as a child or eligible as an adult, those requirements are staying the same. We did get several questions in a couple of specific eligibility areas that we would like to address. One in particular is regarding the innovations waiver. So if you have an intellectual or developmental disability or your family member does, you remain with the LME MCO. If you already have a slot in the innovations waiver, you remain with the LME MCO. If you are on the waiting list for a slot in the innovations waiver, this is where you may remain with the LME MCO, but you are also given the option to go on the standard plan. And so that means that you may, or your family member may have received a letter giving you this choice. But this is where it gets tricky. What you really need to be aware of is that if you were given this option and you are considering a move to the standard plan, the one thing that you could lose if you are receiving it is state-funded services. State-funded IDD services are only available through the LME MCOs, and it will remain that way even when we have tailored plans. We also got questions in the eligibility when someone has Medicaid as a secondary insurance. It doesn't matter if Medicaid is your primary or your secondary insurance, NCDHHS is still assigning individuals to a type of plan within Medicaid. So if Medicaid beneficiaries with other additional insurance have other additional insurance, they will be assigned to the options are the standard plan, the LME MCO, later to be the tailored plan, or NC Medicaid Direct. If you received a letter asking you to enroll in a standard plan, again, you should do that by December 13th for you to have a choice in who your prepaid health plan will be, or NCDHHS will begin auto-assigning on December 16th.
And we understand that we're moving sort of quickly through some of this information. Remember, there's a Q&A document that will be available to you that answers these questions again, even with some more detail, and you will have that as reference information. So as we move through this, if you're trying to take notes or absorb everything really quickly, please remember you will have that information at your fingertips to review as reference information.
And you can listen to our lovely voices again,
yes,
if you really want to, and read the slides again.
So this will all be available to you after the fact. So as we continue, we are now going to move into that section that we talked about, services within the standard plan or LME-MCO. These are services that are and will be available to beneficiaries, and these are services that are provided through the standard plan PHP or through the LME-MCO if the person is not on the standard plan and is remaining with the LME-MCO in February. And we're starting with transportation. We know that for some folks, transportation is a key to receiving services. Medicaid has provisions to fund non-emergency medical transportation, and this is not new. And as this slide explains, when the standard plan goes live on February 1st, beneficiaries who are on the standard plan and need transportation assistance to attend appointments should contact their PHP to request help. People remaining with the LME-MCO and people on NC Medicaid Direct, which is another term for fee-for-service, those folks make that request through their local departments of social services. So those options remain on the table for folks, whether in the standard plan or through the LME-MCO or Medicaid Direct. We received a number of questions regarding provider networks, particularly in terms of the standard plan. Provider networks in the standard plan are open networks. From the perspective of the state, it's really pretty simple. PHPs are required to have enough providers to provide services according to the required benefits defined in the standard plan, and they should have enough providers to ensure that Medicaid beneficiaries have choices of providers. And the same is essentially true for the LME-MCOs. Although the LME-MCO networks currently are not open networks, they're closed networks, they are also required to ensure that they have enough providers for required services and that they can provide choice for beneficiaries. So in both cases, provider choice and sufficient numbers of providers for services are requirements and expectations of the state. We also received some questions about how many providers are in network. And honestly, we don't have the numbers on those, so we can't tell you how large any of the networks are and where or if PHPs are struggling to identify providers according to services or in any parts of the state. We just don't have that information. So we just wanted to make you aware of that. And as with provider networks, DMA has established rules around pharmacy benefits. And in this case, rules around pharmacy benefits pretty much fit in under the term formulary. The formulary basically tells the PHP what medications Medicaid will pay for. Our understanding is that the formulary is what the PHPs use when approving medication for patients, and that PHPs are not required to approve medication that is not on the formulary list. But as this slide notes, PHPs do have the option to approve and pay for medication above and beyond or not on this formulary list. The pharmacy benefit for tailored plans now will go live in July of 2020. So for the standard plan, the formulary will go live presumably on February 1st, and for the tailored plan, it will go live in July of 2020.
Another category where we got a few questions are about those services that are outside of the standard plans and the LME MCOs and are covered by Medicaid. There are a few services that Medicaid covers now, and they will continue to cover, but they have not been put under the benefit packages in the standard plans or with the LME MCOs. So they include the Medicaid services that are provided in schools, the services that are provided through the Children's Developmental Service Agencies, and the services that are provided through local education agencies. Those will not change. They will still be available through Medicaid, and they'll be available if you need them. It doesn't matter if you're under the standard plan or with the LME MCOs. The schools, the LEAs, and the CDSAs will bill NCDHHS directly to get reimbursed for services they provide. And another category where we got questions is about transitions of care. People seem to be generally anxious about how a Medicaid beneficiary will move from the standard plan to the tailored plan if their service needs increase. So we're going to cover 2 points in our responses, and I know our PHP sponsors are going to also touch on this topic. If a Medicaid beneficiary in the standard plan switches to the tailored plan because of hospitalization, during the interim, the standard plan will continue to pay for their inpatient care, and the standard plan is responsible for transitioning them to the tailored plan. Most of the time, your PHP and or your provider will be able to make the request for transition for you, but you can also make the request to transition to the tailored plan. And speaking to that, there are a few people, or there probably will be a few people, who believe that they should be in a higher service that is only in the tailored plan. If this happens, you can talk to your provider or you can call the enrollment broker specialist, and they can help you to request that you get moved to the tailored plan. And I'll add that you can call your prepaid health plan as well. The request will go to the NCDHHS. Your prepaid health plan, the LME MCO, the provider, and the enrollment broker cannot make this decision. It will be NCDHHS making the decision. And a key role is care managers. We talked about that before, and we want to mention it one more time. Care managers will work within their advanced medical homes, and the care manager will help Medicaid beneficiaries navigate all through their physical, their behavioral health care needs, their pharmacy needs, and their unmet health care needs under the standard plan. If you're not assigned a care manager under the standard plan, you can make that request to your prepaid health plan. And I just want to mention that care management under the tailored plans is still under construction. In the meantime, Medicaid beneficiaries who are with the LME MCOs will continue to receive the care coordination services that they are currently getting through the LME MCOs. So we also wanted to be sure to talk about how you can get more information or ongoing information and where you can give feedback. NCDHHS has been pretty transparent about their vision, and leaders of DHHS have said that they welcome feedback on every aspect of the Medicaid transformation ongoing. A couple places where you can keep up with what's going on and stay informed. You can keep up with how the transformation is progressing by educating yourself on the different roles of organizations and individuals and how they can help you. There are a lot of resources out there. I personally go to the DHHS Medicaid Transformation website almost every day to see what's new, see if they've posted anything new, and to make sure that I read it. I also go to the enrollment broker website, ncmedicaidplans.gov, frequently, just to see if there are some new meet and greets or if they have some new information or resources that they've posted. As much information as NCDHHS has made available, I will admit it does take a lot of time to go through all of the concept papers and other materials that they have written. So we at I2I Center have been keeping track of the latest information and boiling much of it down to the main points. We want to offer to you our website, so feel free to use the IDI website to access that information. Another thing that I know you all know very well is about how to advocate for yourselves and others during this whole process. But we want to be sure that you have the contact information to do that. So there is an email address at DHHS where you can submit feedback at any time on any aspect of Medicaid transformation. And it's up there on the slide, medicaid.transformation@dhhs.nc.gov. You can call the enrollment broker if you want to make suggestions about how your enrollment and access to your information can be made more user-friendly. You can contact NCDHHS directly using that email that I've given you, or you can contact the enrollment broker, and their phone number is right there, and we've given you their website as well. And another big area that you all know well because you are in your local collaborative is that you can join a key work group in your community or at the state level. Your local collaborative is a perfect example of a key stakeholder group that can have impact locally and at the state level. You can share resources with each other. You can identify issues that are impacting everyone and develop recommended solutions. And then you can decide ways for you to take those recommendations outside of your collaborative to be heard. You have knowledge about the behavioral health and IDD system that no one else has.
And we'd also like to mention one more resource that is not online yet, but will be coming to you, we hope, soon, and that is the Ombudsman. The Ombudsman will be available to all Medicaid beneficiaries when the standard plan goes live. This is an additional service and potential support, as I said, that will go live when the standard plan starts. North Carolina is actually required to provide the Ombudsman function for Medicaid beneficiaries as part of its agreement with the federal government. DMA is currently in the process of reviewing applications from organizations that have applied to function in the role of the Ombudsman, and we're hoping to hear an announcement about that anytime now. When the Ombudsman office is up and running, it will provide the functions listed on this slide, and that includes information and education. What that means is that office will offer beneficiaries information on program benefits, coverage, access to services, eligibility criteria, as well as information on grievances and appeals, fair hearing processes, and help with navigating Medicaid. It will also deal with issues resolution. It will serve as an advocate to assist beneficiaries with issues and complaint resolutions through one-to-one assistance. And it will also coordinate efforts to assist with resolutions across organizations when necessary. It will provide some referrals. It will provide well-coordinated referral systems to alternative pathways for obtaining assistance, consultations concerning beneficiary healthcare needs, and it will conduct trend monitoring. This will include referral, tracking, and reporting, as well as monitoring and trend reporting of delivery systems and beneficiary concerns, and it will provide feedback to the Department of Health and Human Services in North Carolina. As I said, that function is not online yet, and is certainly something that we're looking forward to hearing more about. So stay tuned on that one. Now, take a breath. We have packed in about as much information as we possibly can so far in about 35 minutes, according to my watch, in terms of providing answers to some of your questions. And again, we're also providing that Q&A document that will offer some additional backup details. But now, we'd like to turn the mic over to our sponsors and partners from Healthy Blue, and maybe Carolina Complete, although we're not sure that Pam is with us. But we'll start.
Hi, I'm here. This is Pam.
Yay! Okay, great. We're going to start with Rita Hanson-Bowl and Brittany Smith, who represent Healthy Blue. Rita and Brittany, thanks for being with us today, and please go ahead.
Rita, I want to mention to you that you are listed as self-muted, so you might want to take yourself off mute.
We're turning the mic over
Okay,
to
all
you.
right, Rita, I think you've got it.
Okay. Did it work?
Okay. Yeah.
Okay.
Good.
Okay. Okay. Sorry about that, guys. My name is Rita Hanson-Bull. I'm a director of network operations over here at Healthy Blue. Thank you for having us today. Transitions of care from a crisis to a higher level of care. How will your PHP connect with the provider? And how will your PHP connect with the LME and the MCOs? Healthy Blue North Carolina maintains and is currently operating a statewide North Carolina-based crisis line, which is open 24 hours, 7 days a week, separate from the LMEs. We have met with each of the LMEs, MCOs, and obtained a list of resources, facility-based crisis services, and mobile crisis providers so that Healthy Blue can contract with all the crisis providers across the state. Additionally, Healthy Blue has case managers that will engage with the providers and the members to assist with transitions of care to the LME or the MCO for the highest level of care. Healthy Blue will continue to meet frequently and collaborate with all of the LMEs and the MCOs to ensure processes and workflows are successful during the transitions of care for all involved. Next, please.
All right, hi, thank you, Rita. This is Brittany Smith, and again, I'm the Community Outreach Manager for Healthy Blue, North Carolina. So this question is, how will your PHP engage youth and adolescents, for example, social media messaging, directed education materials, online resources? So in regards to social media, we do have our Facebook page, which is Healthy Blue NC, and that has a variety of rich content that's engaging, members that are following our page, or community members rather, that are following our page. So the content may be around health-related news stories to showing events that we have coming up, or even recaps of past events, especially with some of the community partners and nonprofits that we are currently partnered with. We will continue to host family-friendly events that have fun, safe, and educational activities for our youth. Some of our events have been back-to-school events, winter warm-ups, where we're supplying hats and gloves for the youth or for families in general. We are currently working with Title I schools and Head Starts as well. Our value-added services are also centered around providing education and rewarding students who are excelling in school. Some of the value-added services, for instance, that I'll mention are for eligible members. We provide youth club memberships, extracurricular activity support, STEM puzzles, educational milestones, tutoring services, summer reading programs, and school supply assistance. And that's just some of the education and youth-related value-added services. Next slide, please. How will your PHP engage families and guardians? So again, we have hosted educational events and presentations at local schools, Head Starts, community events, community health clinics, laundromats, and other places we believe parents frequent. Also, I think a great starting point too is that we work, of course, alongside the other plans to go to DSS offices and other partners that allow for us to do so. But then also our partners are a great resource in letting us know about other locations or organizations that could benefit from us coming in to provide education to parents that will be there. Also, we will host more events for members and non-members in the upcoming year. And next slide, please. So do you plan to engage with local consumer and family advisory committees? We'd love to engage with all of you if you'd have us. I know that we're working with a few NC collaboratives that they mentioned earlier. I'm currently in the different regions and other groups that you may be a part of as well. So we are definitely open to working with all of you. And next slide. And I'll hand it back to Rita.
Thank you. This next slide gives you a broad overview for our commitment to our stakeholders, the transition with continuity of care, our stakeholders' interactions, and our key partners, which I'm going to go over a little bit. The government agencies, our healthcare organizations, tribes, faith-based organizations. A lot of this information is on this slide that Brittany had already previously talked about, but wanted to give you guys more information on this, and you can read it in more detail amongst yourselves or discuss it amongst yourselves. And that ends the Healthy Blue presentation. So we'd like to take this opportunity to thank with you guys, and please reach out to us if you have any questions or if you'd like to continue with the partnership. We would appreciate it. Thank you.
So Rita and Brittany, thank you very much for that. I think we have as listeners in our audience, some pretty active and interested individuals, and I think you probably will hear from them in the not too distant future. So we appreciate you making that offer to them. So thanks for that.
Thank you.
And the other individual that I'm pleased to know we have on the line is Pam Perry. Pam, I'm sorry that I sounded questionable, but I didn't see your name pop up on the screen. So thank you for being here. Pam is with Carolina Complete, and Pam, the mic is yours, and please feel free to tell us about all of the great things that Carolina Complete is involved in right now in terms of reaching out and being involved with the activities and connecting with some of our consumers.
Great. Thank you, Mary. And thank you to I2I for sponsoring this great event. I think it can only help share information about what is going on with this program as it evolves in real time. As you mentioned earlier, you know, the question about whether the February 1 rollout date will stick is, I think, on everybody's minds, but I think we'll have an answer on that in short order here. So thank you very much for having us. Carolina Complete Health is one of the 5 PHP offerings in the state. On the previous webinar, as Mary mentioned earlier, you kind of went through some of the groundwork, the basics of the program and the initiative as it has been designed. One feature of that is the 5 PHPs that are participating in the program, and the 6 regions that were contributed for Medicaid transformation. And I always say that these regions are unlike any region that you're familiar with under DHHS or the incumbent LME MCOs or the public health regions or any other regions that you may be familiar with for health and human services in the state of North Carolina. The 6 regions were designed uniquely for Medicaid transformation, really reflecting provider access patterns for Medicaid beneficiaries across the state, and obviously geography that would capture kind of a core group of Medicaid beneficiaries within a region to allow a PHP, a health plan serving them to be successful. Carolina Complete Health is a joint venture between the North Carolina Medical Society, and the oldest statewide association, I'll note, and the Community Health Center Association, representing the federally qualified health centers in the state. So we're sort of in Centene Corporation, which is the country's largest Medicaid-focused managed care company. And so we're sort of blending expertise on kind of core Medicaid managed care that Centene has learned and its experience since 1984, delivering these services, and the local attributes and expertise of both the medical society and the community health center across the state. So we are also the only PHP that is not statewide. We're in regions 3, 4, and 5. So the kind of Charlotte-Mecklenburg, Raleigh-Durham, if you will, just to very much oversimplify the regional demographics, and then Wilmington-Fayetteville in Region 5. And so we're fortunate in terms of serving the county with the best health outcomes according to the county health rankings in North Carolina, Wake County, and as well as the county with the, that is ranked number 100 in Robeson County. And, obviously a big feature of this program is to deliver improved health outcomes for Medicaid beneficiaries. And we hope to do that along with our fellow PHPs. And we'll have real strict quality and performance improvement requirements, as well as incentives to encourage providers that are currently providing care to Medicaid beneficiaries to continue to see them, as well as to bring on new providers so that we can grow the provider base in the state, particularly as it relates to some underserved areas or specialty services that are, not well represented in terms of under Medicaid right now today. So we're real excited for the opportunity and looking forward to being of service. Obviously another big feature of Medicaid transformation in North Carolina is the integration of core behavioral health, mild to moderate behavioral health and substance abuse services, and the unique feature of the tailored plans, which is still due, even with a potential delay in the core kind of standard plan program. All the signals from DHHS are indicating that the tailored plan initiative, which will be for the first life cycle of tailored plans, first 4 years, will be under the auspices of 5 to 7 of the current incumbent LME MCOs, and they're expecting that request for applications is still going to be on time in late February or early March to be issued for that program, which will go live in July 2021. So that's a little bit about Carolina Complete Health. Just to go through the questions, Mary did a great overview of a lot of the features and details. So in my Blue Cross Healthy Blue colleagues as well. So a lot, again, of what you're going to see plan to plan is going to be very similar. They're going to be, obviously, the state in rolling this program out wants to have a uniform approach in terms of access to services, uniformity of care, and excellence in terms of ensuring that outcomes are achieved in quality metrics, performance metrics, et cetera, among all 5 health plans. So there are a lot of similarities in terms of how we do the work. There are different features in terms of some of the in lieu of services or value-added benefits that each of us will provide. Again, Carolina Complete Health is the only provider-led plan, and that's a unique feature that we bring to the table. And I think that means, just to oversimplify it, is that I always say that we are the plan that has providers back. We are governed by a provider-led governing board that will set criteria as far as how we work with providers, and these are providers, again, that are serving Medicaid beneficiaries. As I mentioned before, we want to maintain and grow the field of providers and enhance their experience however possible when you're adding 5 additional plans for a provider to work with. So again, trying to really work proactively with providers and ensure that their experience is optimized so that the services that they can provide to Medicaid beneficiaries does not erode. Sharing, some of those best practices with the state, with our fellow PHPs, to try to get, to some, level playing field in terms of the provider experience that also ultimately translates into the experience of a Medicaid beneficiary who's sort of navigating the system, and hopefully they'll have a lot of supports in many cases, additional services to help them get the care they need, improve their health outcomes, and really, have some, better understanding of, what they need and how they can access the services that they need to address, whether it's a health condition, behavioral health, primary care, behavioral health services, long-term services and supports, social determinants of health, which is, again, another big feature of North Carolina's approach that is unique, addressing how issues such as food insecurity, housing, transportation, interpersonal violence, toxic stress, affect Medicaid beneficiaries' health outcomes. If you don't have food to eat or a healthy diet, how can you improve your, outcomes on diabetes and things like that? So it really makes a lot of sense. North Carolina maybe is one of the first states to really put some structure around how the health plans will play a central role in ensuring that those outcomes are enhanced through addressing social determinants. And so, again, we're real excited. So let me, without further delay, get through the questions. So transitions of care from crisis to a higher level of care. How will we connect to the provider? So as soon as we learn of a member's need for crisis services, and usually That could be at the provider level. That could be all of us will have a nurse hotline, a 24-hour hotline that members can access any time of day or night. It could be a lot of our members with complex health conditions or concerns will have care managers that will work with them directly. Some of the community events, I think my colleagues at Healthy Blue had mentioned, we're all out in the community, out in the field, and a member could certainly avail themselves of a community outreach worker, community resource that can connect them. So the idea of no wrong door as it relates to our members is really true in terms of connecting them to the services they need. But once that identified need is defined, our care management team sort of takes it over and can work with that member and make sure that they do receive the right level of care with crisis.
Pam? Pam? Pam, if you can hear us, we lost you. Okay.
Maybe we can get some additional comments from her in writing.
We seem to have lost Pam Perry. Which is unfortunate. Whatever else she was going to say in terms of her comments regarding the particular questions, as Ann said, we will ask her to maybe just jot down some responses and send those along at a later date. Just sort of stalling to see if she calls back in, but I'm not seeing anything. So we will just proceed. If Pam can hear us, I'm thanking her. If she can't hear us, we'll do that afterwards.
Hey, hey gang, sorry,
Pam.
I dropped off. I'm back, I think.
Oh,
I'll just.
okay.
You are.
Well, that's great. And Pam, what I'm going to tell you is you've got about 3 minutes here. So we're glad you're back. Yeah. So if you could just sort of whip through the rest of your answers, we'd appreciate that.
Oh, perfect. Okay. So again, for crisis services, I think we're all working with the LME MCOs that are providing some of those services today and really figuring out the best approach to maintain that level of service. I think one thing that we've learned is, the current state is not perfect. And the goal is obviously to improve things across the board, but there are some things that are working really well. For example, how some of the crisis services that are out there help work with the local sheriff and some of the schools and things like that. It really helps connect beneficiaries to areas where they can address those issues without going into, the ER, without going to jails and things like that. And so we're sort of, I think, as our, colleagues and Mary, as you've attested to, we're, working with DHHS, with the LME MCOs to sort of figure out the architecture of how all that looks and to develop it so that, in terms of contracts that, will work for the members that we're going to serve. Okay. Youth and adolescents, social media. So again, a lot of our, community resources, we're working with the DSS offices, health departments, with some of the LME MCOs are doing their own member education outreach events. We're all over the state, as are, other PHPs out there, really hoping to get information out to, in real time. And these events are occurring, every day, multiple events on a day and that sort of thing. We have a Twitter feed for Carolina Complete Health. I think we all have websites. Ours is carolinacompletehealth.com. And I would encourage folks to kind of look on. We are posting our events on the website and through our Twitter feed. Twitter obviously is very interactive and allows you to, hey, what's this event about, you're doing a YAM festival. What does that mean? So we can interact and give you more information, and figure out what services what we're doing at those events. So every event is a little different, whether it's a festival or a health fair, or and working with the DSS offices to get information out, in this early enrollment period. Families and guardians engaging. Again, a lot of this, the families are, that are members are going to, and families of our members are going to be kind of on the front lines as, share, with our sharing of information with the member who has a family caregiver. That will be, part and parcel of our outreach with the member, making sure that they're engaged and they're understanding what the needs are and how to navigate the services that family member may need, even if that again, caregiver family member is not a member of Carolina Complete Health, through, again, our care management teams being on the front lines and really doing one-on-one engagement with members and families to make sure that the right services are connected with that member. CFACs. So yes, we will be working with the local CFACs. We've been attending all the statewide or the statewide CFAC meetings as well. Obviously, those local CFACs roll up to the statewide CFAC at the next monthly statewide CFAC meeting, December 11th. They're actually having the PHPs come in and talk with how our member advisory committees will be developed. And our member advisory committees are really going to be opportunities for community engagement in a way that really influences the programs and policies of the health plan. They will likely be regionalized, so one per region for most of the plans is what I would expect, and then multi kind of faceted in terms of, okay, behavioral health expertise and community representation. Chronic disease, prenatal care, so some of the main domains of where we're serving our members on the front lines, those member advisory committees will advise on, okay, hey, you're doing a high blood pressure screening at a school. Well, you may be doing something that's more targeted towards youth is something. So getting real-time advice and direction is going to be real important. And I will say, again, our approach is no wrong door as far as healthcare services are considered. So CFACs are very important and serve a vital role in terms of advising their local LME MCO and the state on policies and programs related to the services that the LME provides. We also are obviously engaging a broad array of behavioral health, substance abuse service providers that may not be affiliated with an LME MCO. So there's that, I just want to make that point there that it'll be inclusive of the CFACs, but even broader as necessitated by our broad, provider base. So I'll stop there. I think we each have, in lieu of, I think, Mary, you touched on the in lieu of services, the value-added benefits. All of us have unique value-added benefits when you're deciding between a plan. Hey, this one provides better, more eyeglasses per year. This one provides, allergy bedding, allergy-proof bedding, and things like that. So some of those may actually help you decide if you're between two plans that all things else being equal with regard to their provider, based in terms of having that your primary care, your specialty providers in their network. Well, okay, rather than flip a coin, let me look at these value-added benefits and see some additional features that may really meet the needs of me and my family, and maybe that helps make the determination of which to select. So that's all I have. Thank you.
Great. Thank you, Pam. Glad you got back on with us. It was really helpful having you on the webinar. Also, Rita and Brittany, thank you also. Feel like we've covered a lot of territory right at about an hour. So folks, we are at the end of our webcast. And by way of summary, I just want to note that between these two webinars and your meetings that you participated in, you now have a number of resources at your disposal as you continue to navigate Medicaid managed care implementation. We understand it's tricky. Over these months, a few things have changed, and in the next 24 hours, we may hear about some more changes. But what we've attempted to do here at Eye to Eye is to provide you with the most current information available to us, and we hope that you have found the information useful, not just for yourselves, but also for other families and the groups that you find yourselves discussing this transformation business in. And as you continue your discussions in your groups today, please remember those lists of resources and the ways that you can stay informed and you can inform our state leaders. They've listened, they do continue to listen, and they need to hear from you. So, thank you. We hope you have a good afternoon. We know your discussions are going to be important and exciting and challenging, and we are signing off for now. Thanks.